You wake up one morning, your shoulder is killing you, and gradually over the next few days, you find that it's more difficult to move, and each movement provides significant pain out on the outer side of your shoulder. You're trying to sleep at night, and your shoulder's waking you up. What's going on? My name is Dr. Howard Lux. I'm an orthopedic surgeon. I'm in Westchester County in the great state of New York. I've been online providing you with easy to understand, actionable information for many, many years. Our website sees hundreds of thousands of visitors each month because the information that we supply you is in language that's easy for you to understand and digest and bring back to your orthopedist to make your decisions about your orthopedic issues a lot easier. If you're an athlete or your child's an athlete, it'll allow you to get them back on the field in a safe and reasonable time frame. So this question came from a young woman out on the West Coast. And it sounds like she's suffering from a frozen shoulder. Frozen shoulder is a very common term. What does it mean? The diagnosis for a frozen shoulder is actually very simple to make. Why? Because a frozen shoulder is very simply a shoulder that is stiffer than your other shoulder. So it doesn't move as much as a normal shoulder would. Now, we have pseudo frozen shoulders where someone can't move their shoulder simply because it hurts too much. But an experienced orthopedic surgeon or physical therapist and trainer should be able to tell a pseudo frozen shoulder from a true frozen shoulder, because in a true frozen shoulder we actually can't move your shoulder more because the capsule or the lining of the shoulder has become thick and it's actually stopping us from moving your shoulder. What causes a frozen shoulder? There are many causes of frozen shoulders. However, most of the time, we don't know what caused your frozen shoulder. It can be caused by an innocuous incident, like a flu shot, or you walked into the door, or you pulled something, you felt a little pain in your shoulder, and all of a sudden, 2 days later, you're waking up in the middle of the night and your shoulder's killing you. More often than not, you're going to sit there across from me on the examining room table, and you're going to tell me that you don't recall injuring your shoulder. You just know that it hurts and you're having difficulty moving it. You're having difficulty taking care of your hair, personal hygiene. You can't lift up to take the milk out of the refrigerator. You can't get a glass to the top shelf in the cabinet. So what's happening inside a frozen shoulder? Again, cause aside, we don't know necessarily what causes each and every frozen shoulder. What happens on the inside is always the same. The lining of the shoulder, which is a structure we call the capsule, the bones are surrounded by this capsule. It's normally quite thin and flexible, which allows you to move your shoulder in any and all directions. The shoulder is a pretty incredible joint. It allows for incredible range of motion, yet it stays together and doesn't always dislocate. So that capsule serves an important function. In a frozen shoulder, the capsule becomes very thick and it becomes very inflamed. So normally if we put a camera inside your shoulder, the capsule for the most part is going to look white. We'll see a few blood vessels, but there won't be anything significant or extreme. In a frozen shoulder, we're going to find a lot of redness. It's going to look like a skinned knee. It's going to look angry and inflamed. So the capsule becomes thick and inflamed. The thickness makes it very hard for you to move because it's not stretching out. And it's going to hurt because of all that inflammation. Now, again, we're not sure what's causing the capsule to grow thicker and become inflamed. But almost everyone with a frozen shoulder will present the same way. It'll start as severe pain, but your motion will still be okay. And then slowly, over the next days to weeks, you'll slowly notice that your shoulder range of motion is diminishing or lessening. Sometimes when we see you for your first visit in our office, you have significant pain with moving the shoulder, but your motion is okay. When we see you back in a few weeks, your motion is worse and the diagnosis becomes clear. So making the diagnosis of a frozen shoulder is not a challenge. How do we treat a frozen shoulder? Many of you with joint pain in general don't want to move that joint. And the main reason why you don't want to move the joint is you're afraid of hurting yourself. Seems logical, right? However, in a frozen shoulder, the way that you're going to get rid of it and get your way through it is by moving the joint. So oftentimes if you know that you're not causing harm by moving the joint, you're more than willing to deal with some pain in order to help yourself recover faster. So is physical therapy absolutely necessary? Sometimes not, but most of the time it is. If you're able to learn the range of motion exercises that you should be doing a few times a day, you can do them on your own. Even if you're using a physical therapist to support you and to show you what to do and how often to do it, you should still be doing the stretching exercises on your own. Now, most people are going to recover within a few weeks to months after starting an exercise program. Some people aren't. Diabetics in particular are at risk for having a more stormy course or a longer course of a frozen shoulder, and most non-diabetics can expect to recover fully, whereas many diabetics cannot. We don't quite understand why it's worse in diabetes, but like many issues with diabetics, the frozen shoulder is certainly a more stormy and worse course. So let's say you're performing your stretching exercises and things just aren't improving. What are our choices? What are our options? Sometimes we can have our radiology colleagues, or if your orthopedist is good with an ultrasound machine, they can put a needle into the shoulder joint. It's not as bad as you think. And they can inject an anti-inflammatory to try and quench that inflammation, that redness. That'll ease your pain and allow you to stretch a little better. Some of you don't get better with injections, and we need to consider going to an operating room. What are our choices when we're in the operating room? First is a procedure called the manipulation under anesthesia. That's when we give you a light anesthetic through an IV, we sedate you, and then we move your shoulder for you. And what it does is actually tears or rips that joint capsule that we talked about. And by ripping it, it stretches it out, and it allows you and your physical therapist to get a jump start in getting your motion back. Many people will respond to a manipulation under anesthesia and recover fully. However, there's a small group who will not. Now we're talking about less than 5% of people with a frozen shoulder. They're going to require a procedure called an arthroscopy, which is where we put a camera inside the shoulder. And then we go ahead and we do a procedure called a capsulotomy. When we perform a capsulotomy, we're actually making a hole in the capsule, and then we're completing that cut through the entire joint capsule all the way around the shoulder, from the front to the back. So now we've taken a slice out of the capsule all the way around, and that's obviously going to allow you and your therapist to stretch that shoulder a little more. These are not immediate responses. You're not going to wake up and feel great and use the shoulder normally. Your shoulder's still going to appear stiff. However, you are going to find that you'll make progress with your physical therapy a lot faster than you were before that surgery. So a frozen shoulder is caused by a thickening of the joint capsule with significant inflammation and association with that. Sometimes we don't know the cause of why you have a frozen shoulder. It's not something to be worried about. If you have diabetes, it is going to take you longer to recover. If you don't have diabetes and you have a frozen shoulder, it doesn't mean you're more prone to getting diabetes. Let's not worry too much about that. So, frozen shoulders. I hope this helps to answer any questions that you had following your visit to your doctor. Again, I'm Dr. Howard Lux. I'm an orthopedic surgeon from Westchester County, New York. I'm going to produce these videos each and every week to help you. Click that subscribe button to make sure you get the next videos delivered as soon as we produce them. Take care.